Coming soon, automatic enrollment from Medi-Cal to Covered California. Hi, I'm Kevin Canals with InsureMeKevin.com. And later on in 2022, Medi-Cal and Covered California are teaming up to help consumers that have been terminated from Medi-Cal and enroll them into the lowest cost silver plan on Covered California. Now, this only applies to MAGI Medi-Cal individuals, modified adjusted gross income. Those individuals that are eligible for the expanded Medi-Cal based solely on their income, adults and children. So the way the whole program is going to work is that when someone has been terminated from Medi-Cal, MAGI Medi-Cal, because their income's gone up or they didn't return the paperwork, then Medi-Cal will send that information over to Covered California. Covered California will look at the zip code and say the lowest cost silver plan in that region for that individual is XYZ carrier, and kind of put them into that plan. Now, that doesn't mean you're going to be automatically enrolled in it. You still need to take some active initiative to actually effectuate the coverage. And Covered California will be sending out notices to detail to people how they go about doing this. Now, if you have a Covered California account, it'll already there. It'll be much easier. But for people who don't, there will be a special website portal for those people transitioning from Medi-Cal to Covered California to go through the process. In addition, Covered California will have a special phone number with trained customer service representatives to assist people with that transition. People can also delegate a certified insurance agent, and that individual can help them through the process. Now, you do not have to accept the lowest cost silver plan in your area. You can change plans. You don't have to stay in a silver plan. You can go down to a bronze plan, or you can go up to a gold or a platinum plan. So you'll have some options. What the goal is for this program is to make sure that people maintain coverage. Because even though Medi-Cal sends out notices that there's a termination, people life is busy. Sometimes they move and they just don't get around to doing the Covered California enrollment or doing it with their employer. And so this is to help them get into at least a placeholder for a plan that they can activate and not have a gap in coverage. Now, you only have 60 days from when you lose coverage to enroll in a plan. After 60 days, you have to wait till open enrollment to enroll. And then sometimes people can get a gap in coverage if they don't enroll right away. Maybe they enroll after 30 days, but that means for 1 month they have no coverage. And if you have prescription medications, that can be a real issue. So you want to stay on top of that. Now, I'm not exactly sure of the entire flow in terms of the income, because the income section is very, very important with Covered California. It will determine, depending on how much you earn on an annual basis, whether you are eligible for an enhanced silver plan, Silver 73, 87, or 94, which has lower cost sharing, lower co-payments to see a doctor, lower deductibles, lower maximum out-of-pockets. So that income section is very crucial, that it reflect your income, and you may be able to get one of those enhanced silver plans. The income section is also very crucial because it determines the subsidy. And if you estimate your income too high, then you're not going to get as much subsidy as if you properly estimate it. But if you underestimate your income and it turns out being higher, you may have to pay some back to the federal government when you do your taxes. So the income section is very tricky and very important. It really needs to be focused in on. And I suspect that's going to be one of the big issues for many people that maybe do not have a Covered California account, is getting it all set up so it's properly in the system. So this is all going to be happening later on in 2022 when the public health emergency is lifted. And Medi-Cal is working under public health emergency rules because of the COVID pandemic, where no one was terminated from Medi-Cal. But when that public health emergency is lifted, they will start doing the annual redetermination for people in MAGI Medi-Cal, well, for all of the people in Medi-Cal, to make sure that they're still eligible. And so over the course of whenever that's about 12 months from when that public health emergency ends, a lot of people will be potentially redetermined ineligible for Medi-Cal and segued over to Covered California. You might be one of them. So watch out for the notices. If you have any questions, call Covered California. If you have a delegated agent, call that person and help you walk through it. Now, we do know that if we have a mixed household, maybe the parents have Covered California with the subsidies, but the children were in Medi-Cal because the income was too low, but now the income is up. Those children will be placed onto the parents' plan. But again, you don't have to have them on that plan. The children could be on a different plan with different carriers, and you can switch things around. So there's a lot of flexibility in Covered California. It can just be a little bit complicated. So if you have any questions about this new Medi-Cal to Covered California automatic enrollment, you can leave comments down below. Go to my website, contact me there. I have done a blog post on this particular subject right here, and there is additional information in there and details, and so feel free to look at that, and I will try and answer your questions to the best of my ability if you pose them to me. So for InsureMeKevin.com, I'm Kevin Canals.